Hi there. It's absolutely fantastic to be back here again this year. I missed MedX last year, which was very, very sad because I absolutely love it. The reason I love it is because of the audience. It is the best audience in the world. I love being in it. I love meeting the people there. It's just fantastic, and I think we're really lucky to be back here again this year. So today I've got a kind of a nice little topic to talk to you about. It's about doing digital with the NHS. I'm afraid I'm not going to be able to tell you how to do that in 20 minutes, but I'm going to hopefully today tell you how to get started, how you can get started doing digital with the NHS. The NHS is a massively complex organization, but if you can get started in the right way, I think it's going to really help you work out how to improve health for the population in the UK. Okay, so a little bit about me. I'm a doctor by background. I worked in the NHS for about 5 years. I ended up leaving clinical practice to do digital health and become a digital health entrepreneur. And I founded MedDigital, which is a healthcare communications agency that does scientific content, websites, and apps for businesses. And this year, we've also launched MedCrowd, which is a messaging technology for health and care teams. I'm also a MedX fanboy. As I previously mentioned, I love it here. And I enjoy drinking beer. So today, I'm not going to be able to tell you how to do digital fully with the NHS, but I'm going to get you started. But my promise to you is I'm going to be here at the conference this afternoon and tomorrow. And I'm going to be drinking beer in the Sheraton Hotel about 7:30 tonight. So if you want to chat about the NHS, there's a few NHS peeps who are coming along for a couple of beers, and we're going to go out to dinner in Palo Alto. So come along and chat there too if you'd like. And maybe we can start chatting about the things you're doing to help you understand how this presentation might apply to your specific activities. Okay, so let's set some context. What is the NHS? I mean, the NHS is a massive organization that offers universal healthcare in the UK. It sees 1 million patients every 36 hours. It's the world's fifth largest employer, just behind the Chinese and US military. And it's got a massive budget of over 120 billion pounds. I found this lovely chart that explains beautifully what the NHS is. And I sat down to try and understand this, and I have no idea what it's talking about. It makes no sense to me. But I love the way they've put a few little circles they couldn't work out how to fit in. They've just stuck them around the bottom. You can see, like, around the edges, a few other bubbles they couldn't connect in. So I looked around for a better chart, and I found this one. This one it's not really quite the organizational structure. It's the flow of money through the NHS. So it's actually quite useful because it shows you who the budget holders are, who the decision makers are. And this is the most useful chart I know that can show you the kind of main organizations within the NHS. But this chart doesn't include the STPs, which have been recently formed, or the HSNs, or the new work with the Digital Catapult and the other catapults, and many, many other organizations around. So it gives you a handle on it, but it isn't the full picture. Okay, so what I'm going to do now is kind of pop a few myths about the NHS, because people think of it as a certain thing, and I'm going to try and help you think of it as something different. The first thing is that people say the NHS is adequately funded, and I don't believe it is. Okay, the funding is not sufficient for the care that it has to offer, particularly given an aging population and more people living with long-term chronic conditions. At the moment, the UK invests about 8.8% of its GDP, which is interesting because we heard earlier today that the US invests 18% of their GDP. And that is being dropped down in 2020 to about 6.7%. So it's not funded enough, and it's dropping down over the next few years. Last year, it's £2.5 billion in debt. That shows that money, that 8.8% of GDP, isn't enough. We're also capping staff pay. And just to pull out one of the issues, there's many others, but recently the junior doctors contract was implemented in August this year, extremely unpopular with the junior doctors, many of whom are making plans to leave the NHS and go elsewhere. And if you were to add all of this up and be objective, you could think that politicians are deliberately underfunding the NHS and destroying staff morale to close the NHS as it is. I'm not sure. I think that's a bit of a kind of extreme view. But if you were running a company and you were doing these kind of things, you wouldn't be expecting it to be a successful company next year. So I think the politicians really need to think hard about what they're trying to achieve here. There's a great video online. I'm not going to show it to you today. There's a great video there, it's 10 minutes long, and it really talks through these problems beautifully. And I forgot to mention actually at the beginning, I've tweeted my slides on the MedX hashtag to a link on Dropbox, and you can download them and look through these as I go through. And the reason for that is at the end, there's a big slide with a lot of information on, with a lot of links to help you get started. And so having those slides will help you be able to start clicking around those organizations and looking at them now. But this video is available. The link is on the bottom of the presentation on Facebook. And it's a junior doctor that's made a beautiful video and animated it really nicely about the big issues facing the NHS. And he's put the numbers in. OK, so the NHS isn't adequately funded, but it's actually extremely effective. It's highly efficient. And in some measures, so there's other ones that it's not always top, it's coming out top. And it's interesting to see the US down there, which is not performing so well according to the Commonwealth Fund. But the NHS often comes out as a highly efficient and highly effective healthcare service, despite its issues and the issues with funding. The second myth I'd like to bust is that it's one organization. It kind of is, but actually, if you're going to go to work with the NHS, these are the kind of number of organizations you're dealing with, and these are just the kind of care providers. These are the kind of main coalface, the main providers of care. If you start thinking about the associated organizations like STPs, AHSNs, AHCNs, etc., you end up in all sorts of trouble with how many organizations there are. And the reason this is important is because these guys are independently responsible. So the person who's responsible for information governance in each of these organizations is actually the person who's going to make a decision about using your technology or your app if they choose to. Okay, but the whole of the NHS has one strategic framework. It's called the 5-year forward view. And if you want to work with the NHS, read it. It tells you the NHS's priorities. And those priorities genuinely are the priorities of those organizations we talked about. Obviously, there's local color. There's different populations in different areas. People believe that there's different things they need to do with their own local populations. But overall, if you want to know where the money's going and where the focus is, it is this 5-year forward plan. So that's very useful. You can get a handle on what the NHS is trying to achieve. And also, there's many kind of programs that work across the whole NHS. I've named one here, and I'm going to talk about a few others in a minute. The Innovation and Technology Tariff. And that gives you the ability to have something, a technology, procured on a national level. And that's fundamentally important because you can be purchased on a national level and then everybody else gets you for free. And that's obviously much more like one organization than those thousands of organizations we were looking at before. The next, which I think is not necessarily a myth, I think anybody who works closely with the NHS knows this isn't truth, but it was a point I wanted to make. The NHS does not have integrated IT. It's got multiple different systems. The NHS program for IT failed. Connecting for Health is kind of grumbled along a little bit. But it's got multiple different systems, most of which don't talk to each other. Often they're provided by a provider that wants to be the ecosystem, so they're not playing nice with others. Often in the same hospital, you have multiple different systems that people have to use across different wards or different care settings. And you've even got bespoke systems being built by healthcare providers in the UK. I mentioned the King's Health Partners local care record. They built a local care record where they have their own patient electronic patient system, which links in with Cerner and other systems locally. But you've got NHS Digital and NHS England and the other big organizations that are setting standards. They're telling those providers how you've got to work. They're setting information standards around and interoperability standards, about standards to pass data between systems, about standards they must achieve to be compliant, to protect data, etc. And those standards are really important because they mean that systems are beginning to play together. And I can definitely see a world where in years to come, if you don't meet those standards, those interoperability standards, as well as the kind of data protection standards, you will not be able to be procured by the NHS. And understanding those standards and complying with them is key if you want to work with the NHS. And you get a feeling why I tweeted my slides, because these links, there's an awful lot of information here, but you can go to those links and follow them and check out these standards and have a look around those websites. Okay, and another example is in some areas we are getting fully integrated care. In Salford, They've got fully integrated care across primary and secondary care. So if you have asthma and you're seeing a GP and you end up in A&E with an exacerbation of your asthma, the A&E doctors can look up your GP records, your primary care records, and they can see what medicines you're on, etc. And vice versa. If you go back in to see your GP next week or in a few months' time and say, my asthma's fine, doctor, don't worry, they can see that you're actually in A&E and you forgot to mention the time you ended up in A&E, and they can say, oh, maybe we need to change your control. And this is quite important also for clinical research, because you've got research happening across primary and secondary care where you can track all different episodes of care across Salford. Clearly, that doesn't, if you end up in A&E in London, you won't be tracked there, but it's a start. It's really useful to see how that information is being integrated. The next myth is that the NHS is free. I don't believe it is. They say it is, and of course most of it is. I mean, it is kind of universal, and the major parts of care are free at the point of care to every UK citizen. But there's many other areas that are just sneakily creeping in. I mean, car parking is a great one. The NHS made £120 million last year from car parking. I mean, that's extra funding. You know, and if you're in a trust that's £2.5 billion in debt, that really helps. You know what I mean? Well, not a trust, but if you're in a system that's £2.5 million in debt. And I've listed a load of others. I haven't bothered linking to them because I think they're fairly kind of obvious things. You can just Google the terms and find out information about them. But it shows you that there's lots of ways that the NHS is getting money from people. And personally, when I've got 3 kids, and when we went through the last kid through antenatal care, we paid for an extra scan. We paid for to buy the images from the scans that you had, like the normal ultrasound scans. You could pay to get the images. You had to pay £2 to get them. We paid for some extra tests on top, screening tests. If we wanted a private room, we would have had to pay for it. If we wanted TV at the bedside, you pay for it. And all of these are ways that are getting patients to pay more for kind of services around their care, if not the actual antenatal care. But what this means is NHS patients are now used to paying for things around their care. And that's fundamentally different from how things used to be maybe 30 years ago. People are used to reaching into their pocket when they get to the car park, reaching into their pocket when they print a scan, reaching into their pocket, et cetera, et cetera, et cetera. Which means if you want to work with the NHS, if you want to go to UK patients with a digital technology or with a technology you want to take over there, the patients will pay for it if it's reasonably priced and it's effective. They're already paying for insulin pumps, and patients are already paying for blood pressure cuffs, et cetera. They're paying for the smartphones with these apps on them. They're paying for the apps. So that means we're in a very different world in the NHS, and that's good for digital technology providers because you can reach patients and they can pay themselves. But clearly it's a question about universal healthcare. And what happened with dentistry in the UK is that they basically steadily reduced the amount of free services that are available until if you live in a nice area like I live in southwest of London, you can't find an NHS dentist. You have to go private. Okay, so another myth is that NHS is bad at innovating, and I disagree with that. I think big organizations are bad at innovating, but within those organizations, and particularly with the NHS, people have really realized, because of the problems we've been talking about, that innovation is a solution they need. They have to innovate, because if they don't, they cannot pay the bills. They cannot provide the care they need to provide, which means it's a fantastic environment at the moment. It's very exciting to be there, because really things are happening. So what I've done here is I've listed a load of organizations, okay, and I'm going to go through those in a minute in a bit more detail. And I've tried to give you a one-line summary of what it is, because it's complex. But hopefully that gives you a bit of a handle on it, and I'll talk about how to get started in a second. Okay, so we've got an environment where we've got a reduction in central funding. We've got patients topping up their care. We've got a genuine desire for people to innovate, to change the way they give care because of the staff and morale issues and the reduction in funding. You've got these central standards coming in, which are being forced through by this central NHS bodies. And you've got these lovely national programs for NHS Tariff, for technology and innovation, etc. And that, for me, means that there's a huge opportunity for digital health innovation. And I think the NHS is a fantastic place right now to do that. And hopefully that's come through from what I've said. So the last bit of this presentation is then to help you guys get started. And how do you actually go about this? So this is going back to the organizations I've just shown you. The list's in the same order. And the reason I put them in that order is it starts from a concept or prototype right down to a system-wide implementation. And I've listed those organizations in that order. So if you've got a concept which you think might help, you start with somebody like the Health Foundry or the GSTT charity, Guys and St Thomas's Trust charity, or apply for Wyra's Velocity Health Accelerator. But if you've got something that is ready for market, there's a big system that you've tested widely across the US, you start at the other end with these NHS programs. So what I'm going to do is now spend a second and just go through each of those kind of organizations and talk about them. So the Health Foundry, actually what I'll do is I'll go back to this slide with the sentences on. You might just be able to see those. So the Health Foundry is a co-working space that enables innovators, healthcare innovators, to come in and network with other innovators, network with investors and potential partners, and also connects them into the NHS with these NHS navigators who they meet and can go in. And so you can get kind of membership there. You can sit in a place and meet other people. And they're very well connected, and they run lots of events to help train you up. GSTT Charity is one of the largest healthcare charities in the world. They have an endowment, so a fund of about £20 million that they invest each year. I love it because the Guys and St Thomas's Trust is actually their tenant. They own most of the South Bank, it seems, in London. And they invest in ideas, and they're also highly connected, and they've invested in the Health Foundry, for example. And so they can get you started with a little bit of cash, maybe £20,000 if you're at the beginning concept stage, to get you connected into the NHS in the right way and introduce you to the right people. Wyra is Telefónica's accelerator, and they've partnered with MSD, or Merck, as they're known in the US, to launch Velocity Health, which is an accelerator for healthcare startups, where you go in, you get seed funding, and you sit with them for 3 months, I think the program is, to get started in healthcare. The DigitalHealth.London Accelerator is a program I've just come off. I was on there last year, and it's fantastic. It's run by an organization called Digital Health London that's centrally funded, that's aimed at trying to get digital health innovation happening in London. It's clever that. You can tell that by the name. And the accelerator is a specific program you apply for. They've just kicked off this year. And the accelerator basically runs you through for a year. They give you a huge amount of support. They're absolutely fantastic. We went into the accelerator with one technology, and within 3 months later, we had a new one based on the learnings we learned from them. I mean, we launched MedCrowd on the accelerator because of the fantastic support they gave us and the connections we made and the people we talked to. Digital London's great because if you're not on the accelerator, they can still support big businesses. And I'd probably say they're probably the best bet for you as a US company if you want to get started somewhere, because they're kind of in the middle of it all. They can connect you with the early startup stages and with the later stages, and they're highly connected. And focusing on somewhere like London makes it a bit more kind of manageable than trying to start, across the whole NHS. You've also got the AHSNs. The AHSNs are academic health science networks, and their job is to make innovation happen in the NHS. There's 15 of them around the country, and they've got various specialist areas that you can look up on their websites. But they're really fantastic. They've got people who work with the NHS that come from the NHS that can help you work with the NHS. But they're dealing with slightly bigger projects, slightly more mature concepts. Digital Catapult's looking at big data. So if you're looking for big data, there's a great place to start. And you've also got, I think it's the Bio-Life Sciences Catalyst or something. There's another catalyst for life sciences and other kind of scientific research kind of projects. MedCity is looking at life sciences again, so kind of pharmaceuticals and even medical devices. And then we're moving into the NHS organizations. So these are for kind of scaling stuff across the NHS. So when you've got something that's working somewhere, probably working somewhere in the NHS, you then go to these other organizations to start trying to get that across more widely. The NHS Innovation Accelerator has just closed their applications, but they'll be doing it again next year, I'm sure. Looks at scaling a proven technology across the NHS. And so that's a great way to just get across the NHS. And they can support you with your applications to the NHS Innovation and Technology Tariff. NHS Vanguards are places with fantastic care in specific areas where they're saying you are the vanguard in a certain clinical area. And so they're a good place to go if you are also working in that clinical area. The NHS test beds are ideally a hospital or a kind of care setting that has a lot of different innovation going on, and they can help you test your innovation more broadly. And it says test bed like it's kind of for concepts and ideas, but this is for quite mature solutions, I think, which are quite well established, but you need to kind of test it in the NHS as a starting point, but actually you already tested it somewhere else and got it working. And then the last one I want to mention is the NHS Global Digital Exemplars, which are kind of the exceptional areas of fantastic care, and Wales is a good example of that, where they've integrated across different systems. Cool. And that is that. So hopefully those organizations will help you start with NHS, and having that context I've talked about will help you really understand why, the things to consider when you get started. As I said, I'm around. I'm on Twitter too, so you grab me there too. And looking forward to meet you all, and good luck with working with the NHS. It's tough, but it's worth it. Thanks very much.